Hi, I'm Dr. Bret Byer from Fort Bend Periodontics and Implantology. And today we're going to talk a little bit about dental implants. I have patients come in literally on a daily basis asking, am I a candidate for dental implants? And I'm missing a tooth here or several teeth there. And will dental implants provide me a long-term solution to replace those teeth? So let's talk a little bit about what dental implants are and how they work. Dental implants are a titanium fixture. So today we use titanium implants, and they're the replacements for roots of teeth. For a tooth, the part that you see is the crown, and the part that's inside the bone is the root. So these dental implants replace the root of a tooth, and then a crown attaches to the top of them, or a bridge, or a denture, or different types of appliances that encompass one or more teeth. There is a cost associated with dental implants, but it's on par with the same. If you'd lost one of your front teeth and you were going to have a bridge, the cost of a dental implant is on average about $500 more than the cost of your bridge. When it's all said and done, you've paid all the bills and you're smiling in the mirror. The difference is the bridge tends to last 10 to 15 years, and the dental implant should last a lifetime. Payment plans in our office include you get a discount if you pay at the time that we place the implants, or you can finance them. We have different finance companies that we work with that'll offer a 0% interest the first year, and then if you go beyond, like say, go up to 5 years, they have finance plans, but you'll pay an interest fee at that point. The implants that you see marketed on TV, the teeth in a day type of approach, the way those organizations operate is when you go into their practices, they pool all of your teeth, and then they replace all of your teeth with 4 implants, and then they screw a denture basically, or a huge bridge on top of these 4 implants. And so that's how you get all your teeth in one day. All your teeth are taken out or extracted, and then the 4 implants are placed, and then a big denture or bridge is screwed on top. And that I think it looks pretty good. The downside of that approach is if you've lost any of your teeth due to gum disease, these types of restorations are very susceptible to gum disease in the future, especially in the first 5 years after you've had them placed. And so if you lose one of those implants, you lose the whole restoration. We do those types of restorations in certain, or implant cases in certain patients, but we prefer usually to do bridge work on top of implants, where you would space out the implants and you have 3 or 4 unit bridges attached to the implants rather than all the teeth in a day. And the reason we prefer that is I'm always looking for how patients are going to grow or age with their implants. Most of the patients that come to see us, they stay with us for a lifetime. And so I'm trying to anticipate what your needs are going to be over the course of your life. And so we plan for cases that if you were to have trouble, if you were to break something, or if you lose other teeth, everything is easy to replace and easy to maintain over the course of your life, rather than if you have one big restoration place and something happens to it, you lose the whole thing. So I tend to think in terms of not just today, getting you in and getting you out, but I tend to think in terms of how are we going to take care of you over the course of your life. I think the biggest advantage to choosing our office over other doctors that are placing implants in Houston, the greater Houston area really, is one, our success rate. The things that we do work. And that's kind of a big thing. I can't tell you the number of referrals I get for things that were done somewhere else that have failed or are in the process of failing. And then who do you go to when things aren't working? Well, that's the issue. That's the reason they get referred to me. So in our particular case, one, we have a very low failure rate. Everything is, not everything, but most everything, 97% of what I do is successful in the implant world. And two, if there are problems, if there are complications, I'm still the guy who takes care of all that. The advantage to come to see someone like me. And I think another big thing is we get quite a few referrals for someone who's had implants, but they don't look good. And part of that process is because sometimes these implant training courses teach somebody how to drill a hole and place an implant, but they don't really teach them all the biology, all the things that are you have to take into account to make someone look like they've never had dental treatment. So, for example, in our practice, we do something called site preparation before we ever place the implant. I'll make sure that your soft tissue has the correct symmetry and shape, and I'll make sure that the volume of your bone that we're going to place the implant into is ideal. And if any of those things are lacking, then I'll prepare those in advance so that when the implant's placed, it's in an ideal foundation so that you look good and you've got something that will hold up over the test of time.